Good morning and welcome back to CityLine. With me, I have the Tacoma Pierce County Health Department. And not the whole department, but I have a fabulous woman here, Miss Edie Jeffers, and you are the Communications and Community Relations Manager. Welcome, my dear.
Thank you. Thanks. Glad to be here.
Good to have you here. We were talking about that necklace that you're going to leave for me at the desk when you leave.
We'll see what we can do.
Yeah, exactly. Going to work that out. So you have something that is new and improved because we have seen lately in the health department in the news with the norovirus situation, food safety, flu, and more. There is a new website, which is wonderful, that is helping you communicate with the public. So let's talk about, first off, how old was the previous website? How long had it been since this since it was updated?
Sure. So adolescents have had entire lifespans and potentially entered into their early 20s since we had upgraded the entire system. We did a kind of a facelift in 2011, but the actual technology and functionality of the back end of it, we've not touched that in about 15 years. So it was quite outdated, quite clunky, not efficient for us to use.
Okay, so walk us through what we're seeing here.
Absolutely. So we took a good amount of time, more than a year, to really completely rethink and overhaul this website and put the customer first. Before, you really would have had to work for the health department to know how to get around on it. The new navigation is healthy people, healthy places, healthy homes, and I want to. And there's many different ways to find information intuitively. We have a blog that really helps us to stay on top of emerging issues and also share just good news and good information and really engage the public. And that's the premise of the entire website, is really making it two-way communication. For a lot of people, the only way that they really experience the health department is our online home, and that's our public face to them, and we're the reliable local source of public health information. So that experience should be helpful and not cumbersome. We rewrote all the content to be much more simple.
Boy, is that ever a job.
Absolutely. Turns out that all of those words and all those syllables are just not actually helpful for communicating.
No.
So we really simplified it. We 8th grade reading level is kind of the sweet spot, kind of regardless of higher education level. People have better comprehension when you hit that sweet spot of that reading level. So the majority of the pages are written at that 8th grade reading level or under. So we have taken a lot of pride in getting a lot of people, a lot of staff members, community members involved and giving us feedback and helping us do this right, and so it's more responsive to the needs of our public.
I love that, and especially the community members part, because I can imagine that you probably tested it. I mean, I know that I'm overhauling a website where I am an executive director in my other job I do, and it's a lot of work.
It is a lot of work.
Going behind the scenes and trying to figure out what they see and how many clicks and how much time you have. So for instance, if let's say I'm looking for restaurants and I heard that there's like a norovirus outbreak. I'm like, wait a minute, is that my neighborhood? Is that where I went? Is that where I'm not feeling so great? I can go right to that on the menu and click on it and notice.
There's going to be a lot of ways that you would get information like that. For example, in this recent outbreak, we used our blog as a way to consistently update and to provide that almost in real time. We were making reports a couple of times a day at the height of the outbreak to update numbers and update the situation. Also, on a day-to-day basis, there's a very easy way to go to the website and find a button that says Food Inspection Reports, where you can look up any inspection report for any restaurant in Pierce County that's permitted. And of course, they all need to be. So that's there, and there's, again, many different ways through that intuitive navigation that you would be able to find that type of information without puzzling over it and having to think through an organizational structure.
Exactly, yeah. And for many of us, I mean, I can think about parents, and we think about the flu outbreak.
Right.
You know, we are in serious numbers right now in terms of the flu and Tacoma Pierce County. I think that a lot of Washington State is. We are in an epidemic. And I think to go to that and be able to say, okay, here are some just basic safety and basic stats about this flu that we know to be true based upon feedback.
Right. And yes, the flu is a serious issue. More people die from the flu than a lot of other illnesses that people might get kind of hyped up about.
Yes.
And we have had 9 flu deaths in Pierce County alone this season. Basically, we started tracking around October. And yes, those numbers are higher in the state, and nationally, flu is an issue. I'm not sure that the epidemiologists have called it an epidemic just yet, but it's a serious issue, and really, we like to talk about prevention and how you can keep from ever getting it. When the flu shot is your best means of protection, and everyone should get that each year. And then there's basic steps that are going to help everyone stay healthier in every situation. Washing hands often and 20 seconds with warm soap and water, more often than you think that you need to. That's a really important aspect of staying healthy from many areas. Also, staying home when you're sick.
Thank you.
Yeah, stay home when you're sick and keep that healing time to yourself. And Washington's new paid sick leave law makes it a lot more accessible for everyone to take care of themselves first and not share their illness with folks at work, which keeps things going in the community.
Oh, absolutely, yeah. I mean, the gift that keeps on giving,
Right.
Stay home, absolutely. So you also have been really creative on social media. Let's talk about that.
Yeah, we've, over the last few years, we've really tried to step up our overall communication game and kind of get with it. And we have done Safer Food Safety, which is something that we're always paying attention to. Food is, we all eat.
That's right.
We all go out to eat.
Yes.
Many people work in food service, and when we are out there permitting restaurants, we're focusing on educating people about how to prepare and serve food safely. Our social media campaign this last September really used humor. We all appreciate a good laugh, and we tried to use that kind of social relevance of the concept of dating profiles for our Food Safety Month campaign, and we basically created profiles for common foodborne pathogens, things that if you just talked about them scientifically, nobody would really pay attention, but we actually created dating profiles for them so that in the specifics that you would read about if you were, going through an online dating type of thing, you would read about, what this kind of germ prefers, and that's going to tell you a little bit about how it spreads and how it's going to get to know you. And we got very creative, and these are searchable on Facebook and on our website. You can find these; they're still worth the laugh. They're the gift that keeps people laughing. We kind of brought the norovirus one back around during this recent outbreak, and they also had positive responses. So throughout the month, we introduced a new germ each week, and we called them germ dates, and they talked about themselves and how they could basically hook up with you. And then in the end of the month, we introduced what we called safety singles. And these were the positive behaviors also kind of built around a personality and a profile of things that you wanted to do, like wash your hands, things you wanted to match up with so that you would stay well. And of course, we ended with a food worker who happened to be, I think we showed that image. He was an attractive food worker. Yeah, he was stock photo. I'm sorry we didn't recruit locally. I'm sure we could have.
Oh yes.
But we got a stock photo of an attractive food worker, and we gave him a personality too. And he, of course, stayed home when he was sick. So he used gloves when he was having bare hand contact with food. So he was playing it safe, and he was the kind of food worker that you wanted to be.
Oh, yeah. Now I have to go check this out.
Yes, you can find them all on our Facebook page. You can search for them really easily by using Food Safety Month or any of the or germ date or safety singles, and they would show up.
I love that. Now,
Yeah.
and we would be remiss if we didn't mention that this app, as we saw on the graphic, is mobile friendly.
Yes, thank you so much for bringing that up. That's a big change that's
It's
so
huge.
important these days. You know, we know that 60% of our users access our website that way, and our old website was not mobile friendly at all. And this one will respond to whatever type of device you're on, whether it's a tablet or an iPhone or an Android, any device. It's gonna convert automatically. Another really important thing about being responsive is every single page on the website has a feedback link. And we want people to let us know, if there's something there that they have a recommendation for us, or they think they would like to see an improvement. We will take that information. We're constantly looking at how we improve this website and make sure that it responds to the needs of our public.
That is, it's just so impressive. I mean, this is just like a new way to communicate with the health department in real live time, which is so wonderful, because now you really have become a resource and a guide for us that is no longer just picking up the phone. It's okay, you have a phenomenal website and I can talk to you now.
Yes.
And the more that we can talk with you, the better partners we can become.
Absolutely. And, that's a really important thing to point out, is that we're people.
Yeah.
And we all have kind of the focuses of our job, and we're busy. But we're here, we're public servants, and we ought to be able to answer questions in a timely way. And this is one more way that really maximizes or leverages our breadth to be able to do that.
Exactly.
Yeah.
Exactly. Thank you, thank you, thank you to you and your team.
Thank you.
For this new website. A lot of work.
Absolutely.
And I'm sure there's other phases going through and things that you're holding your breath and looking at. But I just want to say, what a gift you've given us.
Oh, great. Thank you.
And I look forward to getting onto my mobile app and checking out the restaurants that I go to and seeing some latest updates of how I can stay healthier. So thank you so very much for being here today. All right. When we come back, after maybe a little hand washing, that would be a good thing. Tacoma Opera will be in the house to talk about Carmen. You don't want to miss that. We'll be right back.